each woman to have the best chance of never seeing the cancer again, and that's what dense breasts mean. Need more work, more diligence to evaluate each woman's breast. We had a woman come in this week, 80-year-old Hispanic woman who had newly diagnosed cancer of the esophagus. The esophagus is the tube from the mouth to the stomach. The cancer had spread to the liver. She was diagnosed a couple of weeks ago at a big hospital in Manhattan. She's already lost 30 pounds. A lot of people with esophageal cancer lose a lot of weight. She's gone down to 125 pounds. She can't eat solids. She can only eat liquids. We spoke to her about treatment options for her esophageal cancer. One is to stage her to know exactly where the cancer is. And then secondly, to offer treatment. Radiosurgery might be great for her because her cancer has spread and she has symptoms, including this obstruction in her esophagus. So it's a nice way to shrink down the cancer in most people, works in the vast majority, and also for a metastatic esophageal cancer, it works to relieve pain, suffering, and actually shrink down the cancer in many of the patients. And while we're in the gastrointestinal tract, we saw a woman, pretty young woman, who had recurrent rectal cancer. She was treated at a big cancer hospital a year ago for recurrent rectal cancer. So a year ago, I met with her, talked about all the options, and she chose another way. She chose surgery at the big cancer hospital. She was seen at a variety of hospitals. And sad to say, the cancer came rip-roaring back only in one spot, only in the rectal area where it was originally, where it was operated once, and then again last year. Now it's back again in that same spot. So we spoke about radiosurgery. We got her staged up quickly. So we know the only active site by PET CT scan is the pelvic area, the rectal area. The tumor's about 8 centimeters, the size almost of a fist. So she is lined up to commence body radiosurgery. Should be 5 treatments. Beams are focused on the tumor area. Success rate is high. It's non-invasive. It's nothing like chemo. Chemo goes in by vein from head to toe. Surgery is invasive. Standard radiation is lots of treatment and involves surrounding tissues as well, whereas radiosurgery is usually few treatments, focused with higher success rates because of radiobiologic principles that a few higher dose treatments work better than weeks and weeks of standard treatment. If you have questions about it, you should give us a call. You can call us during the week at 212-CHOICES, 212-CHOICES. I know many people are shy about calling the radio show, but certainly call during the week. So we take those calls. Obviously, best is to come in, sit down, and spend some time together to go over the details of the case, to learn more about what you have, where it's been, what are the symptoms, give you copies of the documents, repeat the staging to know where the cancer is today, if that's necessary, and then you're the president of the United States of your body. You decide, after hearing all the options, which direction you want to go. It's your body. You are the president of the United States of your body. Now, the president, as we know, doesn't always make the right decisions. So this is a man who came in, 60-year-old man with prostate cancer, was diagnosed in 2008 with a Gleason 8. So Gleason was a pathologist. He tried to tell us how aggressive cancers are. The higher the number, ranging from 2 to 10, the higher the number, the more aggressive the cancer. So a Gleason 8 is an aggressive cancer. This gentleman came to me in October last year with a PSA of 11 and declined therapy. He said he was going to do something else. Well, what did he do? He tried herbs, alternatives, vitamins, antioxidants, intensely. He made a big effort, spent a lot of money with all those herbs and antioxidants. And the result, his PSA was 11 then. Today it's more than 20. So the PSA has doubled. He's in big trouble. He's waited a long time. We know the death rate in the black male community from prostate cancer is twice that in the white. Why? Mainly because of waiting. We urge you, if you have cancer, to come in. We promise to see you within one business day. We'd rather work more than you suffer more. So for this gentleman, we're restaging him, making sure the cancer's still localized. Now he wants to be treated. Wow, he's on the edge. He's on the precipice. We need, I believe, to get treatment going soon. So his PSA went from 9 to 11 to 20 plus in just a short period of time, doubled in 6 months. So we wish him well. If you look at our data, and by the way, we have a prostate cancer booklet. If you look at the data, for example, for a group of men with PSA 20 to 50, people who have surgery versus us, our method is treating in the stereotactic frame and brachytherapy. 66% more men are cancer-free if they come to us than if they had radical surgery. So this is page 6 of our new prostate booklet. We have a new prostate booklet just came out. We're happy to send it to you at no charge. Just call us during the week, Monday through Friday, 9 to 5. We'll get your name, address, and telephone number. We'll put a package in the mail. You will see figure 7, page 6. If you have a PSA 20 to 50, there's a 66% better chance of being cancer-free with us than if you went to the chief of surgery at a big cancer hospital. And we know, if you look on page 14, the likelihood of sexual problems after surgery, whether it's open or robotic, is 97%. The likelihood of urinary problems after surgery, 80 to 86% with open and robotic surgery. So I know robotic is talked about like it's super-duper pooper scooper, but in fact the toxicity rates in a study from Harvard Medical School, this is figure 21, page 14 of our prostate cancer booklet, shows actually the complication rates with sexual complications and urinary complications are higher with robotic surgery. So if you want the best chance of being cancer-free, best chance of keeping sexual life, best chance of keeping urinary life, we know the answer. It's 212-CHOICES. Call Dr. Lederman, 212-CHOICES. Also, there's information about watchful waiting in the booklet, which we can talk about if someone calls, or better yet, just order the book, no charge, and read about it. So for this man, PSA 20, high Gleason score, we're restaging him, making sure he's a good candidate. We don't want to treat him if it's not going to help. We want the best chance to help him. We don't like to do things for no reason, and we're moving ahead. There's also seems to be an epidemic of skin cancers right now. We're treating one man with 4 skin cancers on his hand, on his left hand. He's coming from Connecticut because he didn't want to have Mohs, M-O-H-S, Mohs surgery, which is like salami slicing of the body. They keep on slicing until they don't see any more cancer cells, regardless of what the body looks like. So you can imagine when you have a salami, you start with a big salami and then you end up with a small salami. Well, some people have a lot of their salami cut off with Mohs surgery. This man had 4 separate lesions of the hand. We're treating it. It's already going away on treatment. You can barely see it. We wish him well. We have another man with 4 lesions on the face, including one big one under the left eye, and that's melting away. It's incredible. So they come in, they have 4 separate lesions treated simultaneously. Tumor's going away. They're happy. Treatment takes about 15 minutes. They come in, get their treatment, and get back to their normal, healthy, good, fun life. And at the bottom of the hour, I want to talk just a minute about a 60-year-old black man, single, no children, who has a Gleason 7 PSA 5.9 prostate cancer. A patient came in. He wakes up twice a night to urinate. We offered medication to help his urination. His sex life was poor. He wants to have the best chance of being cured. If you look in our book, Gleason 7 Cancer, and I give you that reference for Gleason 7 Cancer, if you go to the hotshot surgeon in town, the likelihood of being cancer-free is 60%. Actually, there's data from Harvard Medical School and from University of Pennsylvania, which is published data a couple years ago as headlines in the paper. For Gleason 7, their success rate was 60%. This is page 11 of our booklet, figure 15. You can see the data from yours truly, Lederman, using the stereotactic frame and brachytherapy. We're at 90% for Gleason 7 cancer, or PSA 10 to 20. The best data, those two Ivy League institutions, was 60%. So it makes a difference where you get the treatment. It makes a difference what your treatment is. And I'd advise you very strongly to look at the data. I can tell you, we see a lot of sad people who see the data after they've had treatment elsewhere. So don't be sad. Look at the data first. Be smart. And talking about smart, we're going to hear from our sponsor for just a minute, and then we'll be right back. Thank you. Talk soon. Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day, because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
You know, cancer, it's not prejudice. It strikes everyone. We've seen the racists with the big C. We've seen humanitarians struck down with the big C. But there are remedies, even if you've already had different measures of treatment, like prior chemo, surgery, or radiation that didn't work. Now, I'm telling you, there's a guy out there who is clearly the best at this. First tryout or second tryout, that's Dr. Gil Lederman. My personal experience in 1991 is he came up with a remedy for my dad. Others had passed on it or just couldn't figure it out. He was able to save my dad's life, and my family will always, always be grateful to him. But look, if you have newly diagnosed and recurrent cancers anywhere in the body, Gil Lederman's the guy to go to. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. So, to hit the cancer, you call 212-CHOICES and set up an appointment with Dr. Gil Lederman, 212-CHOICES. Or do it for someone that you know won't do it for themselves. He'll send you an informative booklet DVD in advance, and then you cop a squat with him at his offices at 38th and Broadway. Dr. Gil Lederman takes most insurances, Medicare, and Medicaid. Just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES, 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back, and there was an article this past week about Dr. Oz. We've spoken about him before, endorsing products which have no value, including a lot of unproven remedies, vitamins, and other concoctions. So this past week he went to the Senate hearing, and there's an article in AP written by Alex Block saying Dr. Oz was put on the defensive Tuesday after appearing before a U.S. Senate subcommittee where he was taken to task for calling a weight loss product of questionable value, quote, a miracle in a bottle, unquote. He was admonished for melding medical advice, news, and entertainment in a way that harmed